Welcome to Weekly Clarity Coaching. My name is Paul Nichols, the Investor Coach. Today I want to talk to you about Medicare. We are currently in the open enrollment period of Medicare, and what that means is for those people that turn 65 this year, or anyone that's already on Medicare that wants to make any changes to their current plan, they would need to do that during the window of open enrollment that falls between October 15th and December 7th every year. Now, this open enrollment period is when people would enroll that are newly 65, or those people that want to, again, make changes. What's going to happen is these changes will take place on January 1st. Now, for those of you who may not be very familiar with Medicare, there's a few parts to Medicare. There's Part A for hospitalization, Part B for doctors and outpatient, Part D, as in Delta, for prescription drugs. Now, what happens is when you enroll in Part A, which everyone would do during this open enrollment period, everyone is enrolled in Part A. That's free. If you're on Social Security, you're automatically enrolled in Part A. But if you're on your employer's plan, you wouldn't enroll in Part B, because what's going to happen is you're going to pay monthly for that Part B part of Medicare coverage. We all do that. Everyone pays at least $100 right now. If you make more than $85,000 as an individual or as a couple, $170,000 plus, you'll pay a stronger monthly premium from about $140 to $320 for Part B. So Part A and Part B would be your hospitalization and doctors. Now, if you're on your current employer's plan, you wouldn't need Part B unless your employer has 20 or less employees in their healthcare plan. Then you definitely are going to want to enroll in Part B, or there may be a penalty for that. By the way, if you don't take advantage of this open enrollment period, especially if you need to sign up on Part B once your employer coverage ends, there's a short period of time that you want to do that in. Or what could happen moving forward is your Part B premiums monthly could have an increase, a penalty increase moving forward. Now we have Part A, Part B, Part D, hospital, doctors, prescription. That makes up what's called traditional Medicare. And there's a couple shortfalls in that area, in the area of a long-term hospital stay, some skilled nursing, hospice care, in the traditional Medicare plan. As a result, private coverage is offered, and that's called a Medigap, or Medicare gap, to fill the gap. And that is an additional plan that you would pay for, so you're going to pay for Part B, and then you're going to also pay for a Medigap policy that will supplement Part A, B, and D. The government offers a program that encompasses all that. It's Part A, Part B, Part D, and Medigap, and that's called the Medicare Advantage Plan. So the Medicare Advantage Plan would take the place of needing Medigap insurance. However, there are a couple shortfalls with the Medicare Advantage over doing traditional with Medigap. One shortfall is in the area of an extended hospital stay. Medigap policy may serve you better than a Medicare Advantage plan. The other thing is if you travel a lot because of physical therapy and some other things, it may not be as flexible as a Medigap policy would be. So to summarize, if you're turning 65 this year, you want to take advantage of the open enrollment period, enroll in Part A, even if you're going to be with your employer. All these changes take effect January 1st for the following year. September of next year, in this case, in this example, you would get what's called the Annual Notice of Change document that would explain to you any premium changes that will be taking place for the following year and compare current coverages, other things that may change, etc., so that you can be well educated about what plan makes the most sense for you. So what's going to happen is open enrollment, take advantage of it in Part A and Part B. Once you get off your employer's plan, make sure you enroll in Part B or there could be a penalty. You have the option of going A, B, D, and Medigap in the traditional, or Medigap, which would cover Medicare Advantage, which would cover A, B, D, and a Medigap policy. If you'd like to learn more about these issues, there's a couple websites you can go to. One is Medicare.gov, and the other one is MedicareRights.gov. So Medicare.gov and MedicareRights.gov. And of course, you can always call our office, Financial Abundance, here in State College. We're a registered investment advisor in Happy Valley. For those of you that may not be familiar with our office, 814-867-5745. This is Paul Nichols, the Investor Coach, pulling back the curtain on the financial services industry and exposing the truth about money and investing. We'll talk to you next week. Have a great day.